The latest on the pandemic. President Trump and the Food and Drug Administration have issued an emergency authorization of a controversial COVID-19 treatment just days after top health experts warned against it. CBS 2's Bauman reports.
In Lakewood, New Jersey, Avram Weinstein feels grateful to have recovered from COVID-19 and is now donating his blood plasma to be used as treatment for those still fighting the virus.
I had high antibodies, so they called me to donate.
Sunday, President Trump and the FDA announced an emergency use authorization. Convalescent plasma is created from blood of recovered patients and contains antibodies which prevent the virus from infecting cells.
We're years ahead of approvals. We would be, if we went by the speed levels of past administration, we'd be 2 years, 3 years behind where we are today.
Emergency authorization does not require the same level of evidence as full FDA approval. This announcement comes after the FDA held off issuing an emergency authorization last week at the urging of Dr. Anthony Fauci from the Coronavirus Task Force and Dr. Francis Collins, the director of the National Institutes of Health.
COVID-19 convalescent plasma is safe and shows promising efficacy.
More than 70,000 people in the U.S. have already been treated by convalescent plasma in an expanded access program run by the Mayo Clinic. The FDA says it's proven to reduce mortality by 35%.
We're removing unnecessary barriers and delays, not by cutting corners, but by marshaling the full power of the federal government.
This is kind of it's a gap measure, which allows us to help to treat these patients, help them fight off the disease until, a drug is actually created and found to be effective.
Dr. Lawrence Fialco is medical director of the Red Cross New York region, which has been working with the FDA since April, creating guidelines for and collecting plasma donations.
Ideally, it's going to allow broader access for patients. The theoretical risks are that we're still collecting data, so we still don't 100% know how effective or partially effective or ineffective this product is in certain patients.
The FDA and the Red Cross are still asking those who have recovered from the virus to donate their blood plasma. On the west side, Bauman, CBS 2 News.